Interesting. And it's important to remind people that when we're talking about getting the vaccine, it's not a choice of like getting the vaccine or not getting anything. It's like getting the vaccine or potentially getting COVID.
Right.
You know what I mean? And when you compare it to that,
Yes.
like we know what COVID does to people. COVID can have a very negative effect on your body for what
We don't even know how long.
It could be long-term effects with COVID. So it's like, what are the long-term effects of the vaccine? We don't necessarily know that yet, but they appear to be much safer than the long-term effects of getting the virus.
Much slower. Yeah.
I think the problem is, though, that some people are thinking, well, maybe I can just wait and let everybody else get vaccinated. I'll just lay low. It's not affecting my life to hibernate. I'll wait till there's herd immunity, and then I don't have to either get COVID or the vaccine, and I can avoid both. Is that an okay strategy if somebody really just wants to lay low and doesn't want to participate in the vaccination?
I think it raises some ethical questions, to be honest. But beyond that, at the rate that COVID-19 is surging, it is going to take quite a bit of time before vaccine uptake gets to a level that it's going to start to reduce incidence. So I really don't think that's a viable strategy. You're going to be waiting for a very, very long time if you try that.
How long do you think that's going to take for the vaccine to start having an effect on the spread of the virus? Because we're not seeing it yet. We're still surging. We're still peaking. We hope we're peaking.
Right. I don't think we're peaking anytime soon, to be honest with you. But,
no.
It's really, really hard to answer. It depends entirely on how well we do the vaccine roll. And I mean, that's about to change, hopefully for the better, because we're getting a new administration, which is going to run things differently. There are so many logistical issues that haven't been considered in advance, which has been really disappointing. And also manufacturing issues. It's looking like we don't have the amount of doses that we expected to have at this point. And now we're running into issues about, well, do we want to give everyone the first dose and make them wait until we have more of the second dose? Or do we want to get at least some people fully vaccinated and then start delivering more doses? It's all really challenging considerations. I think we should see a reasonable slowing of cases, hopefully by the time we get to about 50% vaccine uptake, but that could, that's mostly a guess.
Interesting. So what time frame do you think that would be? Like by March, April, we'll start to see?
I love that you're so optimistic that you think that that's going to happen like before the summer.
I'm ready to get back to work, man. I'm ready to get back out into the world. We've been hibernating. It's not fun. It's not fun.
No one likes this.
If we're ready, I'm just going to jump right in. This is my take on why everybody should get vaccinated, because I want to freaking get back to work. I want to go back into the world and do awesome stuff. It's been so much fun this year doing this podcast in this room with no walls, but hibernating for over a year. No, stop. Hibernating for over a year is miserable. We have so much cool stuff to do in the world, and all it takes is, I mean, it would have been nice if people wore masks and socially distanced, but all it takes is getting the vaccine.
Started that.
Get out and get the vaccine. All right. Anyway, let's get back to the questions with our expert here.
John just really misses going to parties, but not nearly as much as I do.
Come on.
I've gotten a bunch of people asking me, like, if I get vaccinated and I complete the series and my friends are all getting vaccinated, can I go and have a party with them? And like, we're all vaccinated, should be fine, right? And I really hate to tell them, like, well, actually,
yeah.
So just to answer that one, we don't really know. The reason that we don't know is because it's not clear right now whether or not a person who has been vaccinated can be an asymptomatic carrier and then spread that to other people. So the answer I've been telling them is that would be fine if you're willing to quarantine for 2 weeks after the party.
Oh, Lord. So we're in for another year of this.
Yeah.
Based on that.
Easily.
That's terrifying.
Easily.
It'll take a while. The Biden administration seems to want 100 million doses in 100 days. My infectious disease epidemiologist friends are like, it's going to need to be like 100 million doses in about 45 days if we really want to crush this.
Wow. Okay. Well, let's get back to the fears. How many people have died from taking the COVID vaccine?
As far as I'm aware, 0.
Well, I mean, it just got rolled out. So far, none.
Wait, I need to hear a clear answer on that again. What was the number?
So far 0. There are a few deaths in association with the vaccine that are under investigation, but I'm inclined to think that they're coincidental. So, for example, one question I've been getting specifically, the media is like covering every single adverse drug reaction. It's driving me nuts because like it's not like they're covering every single death from COVID. But anyway, there was a doctor in Miami, an OBGYN, who took the Pfizer vaccine. And tragically, he ended up dying of a condition called immune thrombocytopenia, which is basically where the immune system directs an inappropriate response against platelets. And in his case, it caused a total inability to clot his blood. He had a stroke, bled into his brain, and died. And it's very tragic. And the reason I don't think that the two are likely related, and again, it's still under investigation, is because one of the key things that was reported was he developed these skin lesions called petechiae, which are these like microscopic hemorrhages that you get when your platelets get very, very low. But they happen 3 days after he got the vaccine. And that is too fast for an immune response. Yeah, it would take you at least a week for if the vaccine were responsible for an inappropriate immune response against his platelets, that would take at least a week to start. And I'm not sure how quickly it would take for his platelets to drop to a level where you would see those kinds of lesions, but I don't think it would be me like that. So it's very sad and it's still being investigated, but we just don't know. And the other one I've gotten, the other question is those elderly long-term care residents in Norway. I think now the number's like up to 30. They received the vaccine and then some of them died. But right now it's not above what the background rate is. In a week, you'd expect 400 people in that cohort to die due to random chance. And I think it doesn't really change much because the elderly in particular, especially those in close quarters, like in long-term care facilities, are at such high risk of COVID that they absolutely have to be vaccinated. There's just no way around it.
That's so interesting. So we're tracking the number of people who take the vaccine and die. And as of yet, there is no evidence that the number of people dying after taking the vaccine is higher than the number of people who would die just in a regular group of people. So the control not taking group. The vaccine. Yeah. Is that fair to say?
Absolutely. It's yes, that's absolutely right. Right now, there have been 0 deaths that have been linked to this vaccine with any kind of certainty.
Well, not just linking it with certainty, but even just looking at the group as a whole, we're not seeing an increase in deaths in the group that is getting the vaccine versus what we would expect to see in any control group of, let's say, a million random people in the population, right? We know that if you take a random sample of 1 million people and you give it a year, we expect to see this number of deaths in that random sample of 1 million people, right? That's a number that we can generate.
So actually, Dr. Bob Wachter at the University of California, San Francisco, has a really good slide on this where he showed if we vaccinate 10 million people over the next few months, we can expect that 4,025 will have a heart attack, 3,975 will have a stroke, 9,500 of them will develop a new diagnosis of cancer, 60 will be diagnosed with multiple sclerosis, 14,000 of them will die. But again, these numbers are based on average risk across the U.S. population. If you consider who's getting the vaccine right now, like the elderly, their risks for these conditions is much, much higher. So these numbers are actually an underestimate of what you would expect by random chance to happen.
And that's the thing that people, I think, just don't have a fundamental understanding of when it comes to science, is that any random sampling of the population is going to have adverse events happen to them. Now you take a random sampling of the population and you administer a vaccine to them, you're still going to have those adverse events happening. The problem is the people who have those, who know people who have those adverse reactions spread those stories and they immediately attribute it to the vaccine because as far as they're concerned, they went their whole life and then boom, they get this vaccine and boom, here's this adverse reaction. It's obviously correlated. But when the science doesn't work like that, you can't draw conclusions from individual samples like that. You have to sample a large population and then you have to compare it to what you would expect would happen just on any given day with that large population. And that's something that's just very fundamentally difficult for people who aren't engaged in science and don't understand science and don't study it and don't spend time with it. It's very difficult for people to understand that, I think. And that's part of the problem that we end up fighting back against. So yeah, that's interesting.
For sure.
So there's no fear yet at this point that there's an increased risk in death from taking the vaccine. What's the increased risk in death from not taking the vaccine and just getting COVID?
I mean, isn't it like an 8% chance? Like
I don't know, but it's non-zero. Don't just go and get COVID, guys.
Well, so the biggest determinant of risk right now seems to be people's age. And for whatever reason, younger people in particular don't really see it as a big risk to them. They don't really think, a lot of them don't seem to think it's a really big deal. And some of them are starting to be kind of lax with their public health precautions. But there was actually a really good meta-analysis that was done that actually compared risks in terms of their annual risk of a fatal car accident, basically. So like that's not a terribly common thing, but it's not terribly rare. So it gives people some ideas. So in those up to the risk ranged in younger adults being defined as 35 to 65, if I remember correctly, to being between 2 and 101 times higher than their annual risk of a fatal heart attack, or a fatal car accident, excuse me. That was their risk of death from COVID-19. If you look at the actual percentages by age, in those 85 and older, it's about 30%, their odds of dying. And that does not consider, again, any risks of morbidity, any long-term health issues that they may develop. And what's especially concerning regarding younger adults is that there seems to be kind of a demographic shift going on where COVID-19 is disproportionately starting to affect them. And as a result, these ICUs that have the sickest patients, a lot of them are younger than 50. A lot of them are younger than what you would expect for a disease that is overwhelmingly fatal to the elderly.
Wow.
It's not a joke.
Yeah, you know, it's amazing that, what is it now, 3,000 to 4,000 deaths a day we're seeing. We're seeing around 200,000 new cases a day. And yet people want to sit here and, you know, be afraid of a vaccine that is being administered to millions of people with zero indication of any increase in death amongst the population that's getting vaccinated compared to this regular sample of population. And people want to sit here and say the vaccine is more dangerous than COVID itself. It's really
preposterous.
It's quite phenomenal.
Thanks for checking out this clip from our show.
To watch more clips or full episodes, click on our profile below.
If you want to stay up to date on all of our new episodes and videos, click subscribe.
And if you have any ideas for future guests or topics that you would like to see us cover on the show,
leave us a message in the comments or connect with us on any of our social media channels at Funtime Program.
Or on our website at funtimeprogram.com.
We'll see you in the next one.
Bye-bye.